It's always a delight to have you join us on the program Flipside with yours sincerely, Oluije Oikohai. Today on Flipside, we are looking at accessing affordable health care and exploring health insurance opportunities. Yes, in our country, Nigeria, so many persons, they don't know the different health insurance we have in our country, Nigeria, especially in Edo State. So today we are here to give you an awareness, to educate you on health insurance. And to do that with us is the person of Ambassador Theodore Ehanire Osas. He is Edo State Coordinator, NHIA. Good afternoon, sir.
Good afternoon. Hello.
Okay, and we also have Dr. Ihariva Elizabeth. She is a health insurance expert. Good afternoon, ma.
Good afternoon, madam.
Nice to have you join us today.
Thank you.
Okay, so let's go straight into the discussion for today, health insurance. Yes, I remember when I was growing up, I used to hear the word health insurance, but I've never one day come to the realization up till now to say, oh, see someone going through the issues of saying, okay, I went through health insurance and this was the package I got. And while I was growing up, I was like, is there no funds? Is there no place and ground to help those persons that are vulnerable in order for them to help with their hospital bills and all of that? So right now I've come of age and I know that there are different health insurance in our country, Nigeria, and also in Edo State. So quickly now, we want to know, what is health insurance? Let's start with Ambassador Theodore.
Thank you very much, Olu, for this opportunity. Viewers at home, you're welcome to Flipside. Health insurance is a system that has been put in place to help not only the vulnerables, everyone, to have free, accessible, quality healthcare services anytime it is needed. It helps them to eliminate out-of-pocket expenses. Okay. Like you said, you were talking about, is there no fund to be set aside to use? You know, what I always tell people is this: when it comes to your health, it doesn't write an application to you that
this is when I'm
this
coming.
is when I'm coming.
Yeah.
And when it comes, what happens if you at that particular point in time don't have money in your pocket? Or even if you have money in your pocket, you have to spend out of pocket. So government decided to put in place this health insurance that will help alleviate, make access to healthcare easy and affordable, without thinking where will the money come from once a premium has been paid.
Okay, so there should be a specific amount that the benefactor must pay in order to get access to the health insurance.
Definitely. The health insurance ecosystem in Edo State, in Nigeria as a whole, is designed in such a way that there is the one the federal government is taking care of totally. Yeah. Then there is the contributory health insurance, where you and I have to contribute. The employer has to contribute.
A quarter.
Yes, a percentage of, maybe you are a government worker, a percentage of your basic, or the informal sector, there is a percentage, which was not just fixed. It was done by actuarial analysis to tell you, because of the benefit package, maybe we'll get there. Yeah, sure. It's the benefit package that actually determines what to pay. So we arrive at that certain amount to be paid so that people can benefit.
All right, so I want to go straight to Dr. Ihariva. We're talking about health insurance. Now, we know that we have different types of health insurance, and someone out there will want to know, what are the different types of health insurance and which of them can my paycheck allow me go for? Because like Theodore said, there is a percentage, there is an amount you need to pay, and also your employer will also contribute to. So I want to know, first off, what are the different types of health insurance we have?
Okay, thank you. Good afternoon once again, viewers at home. Talking about types of health insurance available,
Yeah.
I would want to divide it this way. We have the formal sector health insurance, which covers government employees.
All right.
We also have the informal sector. We also have private health insurance.
Okay.
So all these have different mechanisms of coming in. For the formal sector health insurance for government workers, by virtue of being government employees, they are able to access that.
Okay.
Then we also have that for, like you asked, for those who are probably not government workers, how do I come in? We have the gift ship. That's group, individual, family, social health insurance program. That covers people who are not in the who are not government employees,
Okay.
like those who are doing a business of their own and all that. Then for the private health insurance, you could actually have the contributory health insurance covered by government, and you want a top up, you want something in addition, you could go for that. You may also not have that at all. You say it is a private one I want to do.
Yeah.
So you are also allowed to do that. All these have various means of coming in. For example, those who are going to be doing the private one for themselves, who are not government employees, who want to do the gift ship, they would have a particular amount they will pay for them to get covered. For the private plans, the different health maintenance organizations that market these plans also have the different plans. That is for the federal one. Now, you also have the one that is covered by the states. That's the state health insurance program, which the employees of the state government are covered, and there are also different other plans, different plans even under the state health insurance plan for those who want to get covered. I believe that in the course of the program, we'll touch on all.
Okay. All right. Also, Theodore. Okay.
In addition to that,
yeah,
we have a very special plan, which most people are not even aware of. It's called the Basic Healthcare Provision Fund.
Okay.
This one is totally paid for by the federal government, and it is free for the vulnerables.
Okay.
For the vulnerables. So when I mean the vulnerables, what am I talking about? I'm talking about the children under 5. We're talking about the pregnant women. We are talking about people living with disability. We are talking about the poorest of the poor. We are talking about the elderly.
Okay.
All these ones are covered for by the Basic Healthcare Provision Fund. Like the name signifies, it is a fund.
Okay.
At least 1% of the consolidated revenue of the federal government, at least 1% is assigned for this program.
Yeah.
For people that we have tagged as vulnerable to access free healthcare at any primary healthcare center accredited and close to them.
Okay, so that's for the Basic Healthcare Fund.
Yes, the Basic Healthcare Provision Fund.
Okay.
It's also part of the program.
So they can go to any health facility and they'll be able to get that.
Yes, you know, there is a stage, there are processes. You need to be registered. You need to be captured. But first of all, somebody may ask, how do you determine somebody that is vulnerable? Children under 5 is easy, 0 to 5 years. You know that this is, when the child is between 0 and 5 years, that child is supposed to be registered. We started by doing this social register to get vulnerable people across the nation and in Edo State in particular. But right now, what we are doing is to get deep to the grassroots. We've told the accredited primary healthcare centers all across. It's supposed to be 1 facility per ward that is accredited. And we have 774 local government in Nigeria. So every ward is supposed to have a PHC accredited by NHIA and the State Primary Healthcare Development Agency. So the children under 5 present themselves at the primary healthcare center close to them, and they are registered. We call it in-facility registration. Outside what had been done earlier, where the scheme and the authority went out to capture people. There is what we call the vulnerability tool that is used to determine who is vulnerable. Those that are 65 years and above are the elderly. They are easily captured. The poorest of the poor, there are some questions that are going to be asked. There are some things that will be cross-checked. If at the end of it all there is a total, and you cross that total, the person is termed vulnerable. And vulnerability is relative. Somebody can be vulnerable today, tomorrow is no longer vulnerable.
Okay.
Something can happen. And there is a change in life and in status. So that is for basic healthcare provision fund.
Okay. But there are some questions or some issues where you hear some person saying, I can't have access to healthcare facility, to insurance, health insurance. How do I go about it? So what are the awareness that government is giving out to these people to let them know that there is a particular place you can actually go to in order for your payment to be subsidized? Because a lot of persons, they don't know about these things, and they don't even know the steps to take and which of this, the different types, like you said, which of them they belong to. So what are the awareness? And if someone wants to start up, where should a person go to?
Well, first of all, like what Dr. Egareba said earlier on, if you are in the civil service,
yes,
it is easy for you. All civil servants are captured.
Yes. Then the private sector.
Then the private sector, the informal sector, which is the bulk of the population we have in the country, in the state. Thank you for this program that you are doing now. Is part of the awareness we are talking about. Definitely, we know the federal government, the state government needs to put in more effort in ensuring that people are aware. Because if somebody is not informed, then the person is deformed. So we are out there. Like the last time we did what is called market storm. We went to the market, sensitized the people. This is what is obtainable now. You people can get registered. Ab initio, some people felt it is one of those government things, it doesn't work and things like that. But towards the end of it, we did a kind of a raffle, and 4 women were picked. The day we called them to say, look at your letter of introduction to the hospital that you chose, they were surprised. Unfortunately, or should I say fortunately or fortunately, one of them was hospitalized even the day we took the letters to them. So we have offices. The Edo State Health Insurance is there, the office is there. The National Health Insurance Authority, the office is there. They can walk in. We have a website. They can walk in, find out, how do I come in? How do I come in? We will tell you, are you going to use the organized private sector? Like ITV is an organized private setting. So you are supposed to even be doing organized private sector health insurance program. Because you are not in the core civil service, but your organization is organized. You approach the National Health Insurance Authority, either the state or the national, making your intentions known that my staff or my organization want to be a part of health insurance. How do I avail my staff with it? So we give you all that is necessary. We tell you this is what you need to produce, because for the formal sector, we know that their appointment letter is needed, their pay slip for the past 3 months to show that they are working, then their ID card is also needed. Also with those that are coming in from organized private sector, they can also bring those documents that we will request of them, and they get registered. Once they pay the premium that we ask them to pay, we register them, and there is a waiting period.
All right. Now, World Bank and WHO says half the world lack access to essential health services. 100 million people still pushes into extreme poverty because of health expenses. So if we're saying we have awareness or we're doing enough awareness, I think this total number should have dropped drastically by now. Currently, 800 million people spend at least 10% of their household budget on health expenses for themselves. A sick child or other family members. For almost 100 million people, these expenses are high enough to push them into extreme poverty. Now, we know that things in our country, Nigeria, and in the world has skyrocketed right now. You go to the hospital, maybe a medication you used to get for 500 naira is now 1,000 naira. Now, this health insurance scheme is there to subsidize these things for these people. Now, you have mentioned different types of health insurance we have in our country, Nigeria. In order for this to be known nationwide, we have the NHIS. We also have the NHIA. So what are the difference? To Dr. Ihariva.
NHIS, NHIA. NHIS is an acronym for National Health Insurance Scheme.
Okay.
NHIA, an acronym for National Health Insurance Authority. The organization used to be known as NHIS before now.
Okay.
And the act that brought the NHIS into operation was actually a non-mandatory act.
Okay.
What do I mean by this? You are at liberty either to get covered by health insurance or not. And this wasn't helping us. In fact, I would say that would be one of the things that was responsible for the low coverage that we have. But May 19, 2022, the act that mandated health insurance for every Nigerian and every legal resident in Nigeria came into operation, making health insurance compulsory. So the NHIS now transited into NHIA. So essentially, same organization, NHIS initially, but now NHIA. Different acts bringing the different names into operation.
Okay. All right. So to Ambassador Theodore, how would you navigate the balance between providing comprehensive health insurance coverage and controlling costs?
Providing comprehensive health insurance and controlling costs.
Yes.
You should know that one of the major aims of health insurance is to reduce out-of-pocket expenditures, like what you just gave to us by the WHO.
Yeah.
These are the challenges that we are seeing that necessitated the coming up of health insurance all over the world, Nigeria inclusive. So when we can fully recover everyone into the health insurance program, then there's going to be a reduction in out-of-pocket expenditure, which leads to poverty. Because, like rightly what you said, most people are finding it difficult.
Yeah.
They are paying heavily for their health services. So if health insurance, the awareness is rightly given, all that needs to be put in motion are there, and the people key into the system. See, there's no need for any woman dying in the hospital because of childbirth, because she didn't have money to pay.
Okay.
Hypertension should be something that can be managed, because there are so many things. See, if you look at our benefit package, what people stand to enjoy or to gain, I wouldn't say enjoy, because health is sickness is not something
you wish for. Yeah.
So, but the benefit package, we clearly state to you that once somebody is keyed into this system, poverty will reduce. there will be a balance. All this spending out of pocket will no longer be there as much. It will reduce, but it cannot be totally eliminated. But it will reduce. Because how does the system work? You are registered into the National Health Insurance Authority or the Edo State Health Insurance. Let's use the health insurance ecosystem as it is, whether the state or the national. You are registered. Contribution is made from your salary at the beginning, if you are a government worker. If you are an organized private sector, you pay ahead, 1 year ahead. If you are maybe a market woman, vulcanizer, any other petty trade that you are doing, bus conductor, association of drivers, there's this gift ship, which is the group, individual, family social health insurance program. You pay ahead. Once you pay ahead, at any point in time you need to visit, you need medical care. Remember, you chose the hospital by yourself. You walk into the hospital, you are treated, but there is a payment that is made at the end of it all. It's 10% of the drugs that are given to you. Because this must be stressed so that people should know. Some people have gone to the hospital and at the end, because of ignorance, they will say pay 10%. 10% of what? So if you are a registered enrollee under the National Health Insurance or under the insurance or, ecosystem, 10% of the drugs is what you pay. Then it's so beautiful. Okay, I can just tell you that for the gift ship that we are talking about, I don't know if I should tell you how much they pay. Should I mention it?
No, don't worry.
To tell you the kind of amount that somebody will pay if there's going to be a cesarean section, that amount covers it.
I think in order for you to say you want to tell the audience what is being paid, I think this is where awareness comes to play, because I have seen, or I haven't seen a private owner, like you have your own shop, maybe you are a seamstress or you have a salon or whatever, and the person tells me I am under an insurance scheme. Now you've been talking about gift. So how are you going out to tell these private owners? I'm not talking about organized sector like independent television and radio now. No, I'm not talking about that. I'm talking about those persons out there, the tomato seller, the pepper seller, the onion seller, the bean seller. So how do you go about telling them of these things? Because they are the ones that they actually need it. We know every other person needs it. Organized sector, you find someone coming to the office to talk about health insurance. In the government sector, it's already there. It's a laid down rules and regulation and all of that. But for those persons that have their own petty jobs, yes, how do you go about, because you've been talking about gift and gift. I haven't heard a market woman say, I'm under any insurance scheme. So I think we should start from Dr. Igariba.
Like you mentioned earlier.
Yes.
We are we wouldn't say we are where we should be, or we are not where we used to be. In terms of communicating these programs to the laymen in quotes, to the traders, to those who are not aware that they should be under these programs. Sometimes we go to the markets. We have flyers that we give to people. Sometimes there has even been a situation in which a person will get members of his association together, and the staff from the office will go there and let them know, telling church members, and those who have also benefited from it also know that, oh, if this is working for me, I would be able to. And in recent times, the number of persons actually coming to register under this gift ship is on the increase. So the awareness is getting better, not where we should be, but far better than where it used to be.
So some persons, they say, and this is to Ambassador Theodore, some persons says, if you're under the health insurance scheme, there is a way that you are being attended to. not as much as those persons that are not under the health insurance scheme. I met a woman and she said, no, I don't want to even bother myself going through the health insurance scheme because there was this man by my side. He was there almost all through the day to wait for the doctor and to get his medications and all of that. At the long run, he had to go pay for the services to be rendered to him, undermining the fact that he's under the health insurance scheme. So I want to know, is there a disparity between you being under the health insurance and just the private person that comes in to say, okay, I have my money to pay, and that person gets more attention than the person under the health insurance scheme?
Thank you very much. We are not unaware of what you've just said. Very, very much aware. And that is why we have the enforcement unit monitoring things like this. Actually, it's not supposed to be so. Now, one thing these hospitals or facilities should know, that health insurance is a game of numbers. Health insurance is a game of numbers. You know, funds are pooled into one place. There's a pooling of funds. Everybody contribution is pooled together, and at every point, if Mr. A needs funds for treatment, it is taken from the pool. So if you have fewer enrollees in your facility, there's the tendency that what you have said now happens. And also, attitude of our people.
Okay, there's the patients themselves.
Not the patient, the health workers.
Okay.
Their attitude. You know, somebody is paying cash. They prefer to take cash. That somebody, the payment is done through maybe a remitter to their account, to whatever, and they are not seeing the payment. And they are not comfortable. They are not comfortable with it. We need to also sensitize our facilities that, look, this is the way to health services. Health insurance is the way. Thank God the new act has made it mandatory. It's only those that need top up that will need to be going to private health insurance.
We're talking about the disparity, yes, between those persons that are under the health insurance scheme and those that are not, the attention being given to this paper. So we want to know, why is there a disadvantage, yes, with the person that has the health insurance scheme and with the one that doesn't?
As I was saying before we went on break, it is true that there is a disparity because of, one, the payment mechanism. Like the facilities, the hospitals, they prefer to collect cash. They prefer to collect cash. Seeing cash and knowing that this person is going to give me cash, they would want to tilt towards that person. But they've forgotten that capitated services makes more sense when you have enough number of enrollees in your facility. So for an enrollee that goes there and sees such a treatment, one of the responsibilities of an enrollee is that he has the ability to move from one facility to another if he or she is dissatisfied with the services that is being rendered. Now, do you know that? Let me use the former setup program for you. When you register one man or a woman, the principal, automatically, most times, you have registered 6 people. The man, the spouse, and 4 children below the age of 18. So if this man goes to the hospital or the woman goes to the hospital, and at the end, the hospital is not treating them well, they can decide to move. If one person moves, that means 6 people have moved. If at the end of the month, 10 families have moved, that means 60 people have moved. Imagine the revenue that is supposed to have come to him on capitation. What is capitation? money, a fee that is paid ahead to you for services to be rendered.
Of which you haven't rendered yet.
And you may not even render it.
Okay.
Because not everybody goes to the hospital, but capitation has been paid on their behalf. So if they would understand this, they would know that the success, most times, of their facility depends on health insurance programs. If they can sit down, because if you treat me well, I go back to my office and say, that hospital, they are very good. The other one will say, my own is not good. Try my own. They come, change, move to that place. So there's this flexibility.
Okay. All right. So now let's get back to, or move down to Edo State. What insurance scheme do we have in Edo State?
For Edo State, like I mentioned earlier, we have the formal sector for the Edo State. Then the Edo State also has a plan for covering the vulnerable in the state that is not covered under the BHCPF program. There's a plan for them. Also, and then in this Edo State plan, you have various plans that you can buy into that's outside the formal sector. Then the BHCPF program that he mentioned earlier, the Edo State Health Insurance Commission manages that for the National Health Insurance Authority.
Okay. All right. So, Dr. Ambassador Theodore.
Yes. We are in Edo State.
Yeah, sure.
When we talk about health insurance, we are not, like people will say, there is this Edo health insurance, there is national health insurance. We are not in competition. We are collaborating. We have an aim. Our aim is to achieve universal health coverage. Even the state and the national cannot do it alone. That is why we need the HMOs to bring in the private health insurance. Do you know how many million people we have in Nigeria? How many have we been able to cover? So we need to diversify, we need to collaborate. So the Edo Health Insurance, they have their own program, they have their own style. Apart from the formal sector, the BACPF, they have their equity plan, that which she was talking about. You can go there and buy a plan by yourself.
Okay.
Just like you can come to NHIA and buy the gift ship plan.
Okay.
That is open to anybody, whether individual. We start with a minimum of 3 people. Or should I say, there's a limit. There's an amount you pay for 3 persons. So whether you are 1, 2, or 3, that amount stands. So in addition, when you are more than 3, it goes into what is called, from 1 to 3 is individual, from 4 to 9 is family, from 10 and above is group. So depending on where you fit in, any of this program is open for you.
Okay.
Just walk in and you will get more enlightened, and I know many people will not be able to listen to this at this time, but if we continue, like she rightly said, doing market storms, street storms, we do, when there is trade fairs, we attend trade fairs to ensure that people come in and say, hey, what is health insurance? We give them flyers, we inform them of what it's all about. And we do stakeholders forum, where we invite people, tell them this is what we are doing, this is what we have done, this is where we were before, this is where we are now, this is where we are going. Okay.
All right, so how long does it take for one to be a part of the health insurance scheme? How long does it take, Dr. Inayomi?
For the private plan, for the individuals. As soon as you come over to the office and you get registered, there's a waiting period. That's after payment. There's a waiting period of 3 months. Wherein all the administrative things and all that will be done, and then the person's name comes out on the register to start assessing care.
So when we say there is a waiting period, maybe someone has
90 days.
Okay, 90 days.
Yes.
Okay.
There's a reason for that. You know, many people want to beat the status quo. Let me just give you a scenario. Somebody may have visited the hospital, and the doctor tells the patient, madam, it's CS you are going to. We've seen many like that. We thank God for some of our facilities. When they see that the patient, enrollee, we call them in quote, cannot afford, most times they ask them, madam, are you not under health insurance? They say, what is health insurance? They will say, come to the office. But because of adverse selection, you know, you want to do a CS of hundreds of thousands next month.
And
then you want to come and register
no.
so that your name will come out. No. We don't do that. So there's a waiting period. Though that waiting period is for documentation and to ensure that you are already in the scheme before even the gift ship that I was talking about. There are some high cost investigations and operations that you are not entitled to until you are already 6 months into the program, because we don't want all this because it will dwindle the fund and the program may collapse. Everybody will now, if they are doing a CS, any operation, they come and do it, you may not see them again. It's supposed to be continuous with what they have paid. They've done their CS and they are gone. How would you come back next time? How can the pause feed another person? So we have this mechanisms put in place.
So there ought to be a continuous payment, like
yes,
like an annually.
Annually.
Okay.
Annually. You renew annually.
Okay. All right. Okay, now let's look at strategies on how we can go about reaching the less or the vulnerable persons. Now, what are the strategies we should use to increase access to affordable health insurance for underserved populations? So how do you feel we can go about that?
I would say communication is key.
Okay.
Like he earlier mentioned, if you are not informed, you are deformed.
True.
When I'm not aware, I would be spending so much out of pocket, whereas I can actually get it for free. When we look at the vulnerable, for example. So communicating these programs to them, and special thanks to ITV for this program, because I know that people in the grassroots are able to at least watch and also, you know, get aware of what is happening. So communicating to them via the mass media, important. Also from our stakeholders forum at our own end, we enlighten our stakeholders, and they also take it back to the people. People who have also keyed into the program and they see what they've enjoyed. They've actually also been our ambassadors at advertising this program and helping others to be part of it.
All right.
I know you would want to add something.
ITV, settling the best. It's not just a cliche. You penetrate into the interiors, both on radio and television.
Yeah.
So one good thing we should do is collaboration. Collaboration is always the best. We can collaborate, jingle production in different dialects so that it can get to the people you are talking about. We keep speaking grammar and grammar. My grandmother in the village doesn't understand. So if we can engage town criers, engage our community leaders, because we do a lot of advocacy because of this program. We visit community leaders, we visit traditional rulers, we pay high profile advocacy to governors, House of Assembly members. We are even calling on our National Assembly members. There's what we call gift ship C, which is the constituency gift ship. So, my dear sister, it is high time we stop buying keke for our people. Let's take care of their health. The money you will use to buy 10 keke can take care of the health care benefit of maybe 100 persons in a year.
Okay.
They will not come back to you to say, Uncle, give me 300,000 for operation. Give me...
That is if registered under the health insurance scheme.
So there's a constituency allowance for them. Let them channel their constituency allowance to take care of the health needs of their people. The House of Assembly, via the Edo State Health Insurance, let them also go to their constituency. If we can do this, health insurance is a solidarity. The healthy pay for the sick. The rich pay for the poor. That is why if you are in the civil service, what I will be contributing as a state coordinator is different from what my driver will be contributing. But it is equitably distributed. We will go to the same hospital, irrespective of what we are contributing. That's what we are talking about. So let's collaborate. Let's make more of this noise, in quotes, so that people can hear. It gets to the grassroots. If we can engage the National Orientation Agency, like MAMSA we used to have in those days, so that they can help us tell our people in the villages, this is for real. They can go to the hospital, especially the vulnerable. They don't need to pay.
Okay. Now, while in the course of your what you were saying, I had to jot this down. Now, is it all health issues that the health insurance covers? Is it all issues? Now, because I know some persons say, oh, there is a particular surgery that the health insurance can't cover. There's a particular drug the health insurance can't cover. Now you're here, live and direct. So we're asking you, is it all ailments that, or all surgery that the health insurance covers? Let's start with our doctor.
Okay, thank you. That will be taking us to the benefit package.
Okay.
And in discussing the benefit package, I will divide it into three. We have what is called, what is covered, totally covered. We also have what is partially covered. That's, you have partial exclusions and you have total exclusions.
I think I need to jot this down. Totally covered.
Yes.
And partially covered. Now we need to know, also know if you tell these persons, this is totally covered, this is partially covered, in order for them to know. But anyway, let's, okay.
So the third one is the totally excluded, that's total exclusion.
Okay.
So
not
you
covered
have
at all.
Not covered at all. So you have total coverage, partial coverage, and incompletely covered. That's totally excluded.
Okay.
Now for what is totally covered, the list is actually inexhaustive.
Okay.
But let me start this way. We have the general, what people would generally complain of. Let me make it easy to be understood. Like generally you have people having malaria, typhoid, upper respiratory tract infection, diarrhea diseases, things that are common to the majority of the populace.
Okay.
Most of those are under total coverage.
Okay.
And you know, medicine also have different specialties. So at the primary level of care, that's where you have malaria, upper respiratory tract infections, things that would generally take most persons to the hospital. Then, if at the primary level of care is the first port of call, like the gateway into entry into the healthcare system. If you now need further care, these are also covered under internal medicine.
Okay. That was still on the total coverage.
Yes. Okay. Under internal medicine, things like hypertension managed by the cardiologist, diabetes by the endocrinologist, then by renal failure by the nephrologist. I think I'm going too medical now, but that's under internal medicine. Under surgery, for those that are covered, appendectomy for those who have appendicitis.
Okay, still on the total coverage.
Still on the total coverage.
Okay.
For obstetrics and gynecology, cesarean section covered. There are also,
that's for the CS.
CS. There are also myriads of gynecologic conditions that are covered.
Okay.
Under psychiatry as another specialty, anxiety disorders, depression, covered. let's leave totally covered because they are, but okay, before I leave totally covered, investigations. If you need to assess the function of the kidneys by doing electrolyte urea and creatinine, covered A and U creatinine, malaria parasite test, Vidal, urinalysis, all those are covered. Now, under partial coverage, high-cost medications like chemotherapy for cancer treatments, you know, that can actually drain the pockets of whoever is affected. Well. That is partially covered. Under partial coverage, for some of the programs, the enrollee pays 50%, the authority pays 50%. Okay. For some of the medications. There are even other medications under partial coverage where the enrollee will just pay 20% of the total costs. Now, for investigations under partial coverage, like cranial CT scan, magnetic resonance imaging, MRI, is also partially covered. So 50%, 50%. For things that are totally excluded, cosmetic surgeries. My nostrils, I think they are too broad.
I don't like them anymore. Yeah.
You pay. Totally excluded. Then conditions that are covered by other bodies, for example, natural disasters. You know, there's another body already covering that. We are not covering, totally excluded. Treatment of AIDS. There's also another body already covering that we don't cover, but the opportunistic infections that may come in during the course of the treatment we cover. So they are actually much. It's not what I can exhaust in a city.
Okay, so Theodore, so which would you advise Nigerians in all of these three we've mentioned now? Which would you advise Nigerians to go for? Because we hear a lot of persons saying, oh, this particular surgery, it can't go.
You didn't get it.
You're not eligible for it. You need to go and look for money. So which would you advise Nigerians to go for? And do you, at the point of registration, do you tell them that, okay, this package is for this, and that package is for that, in order for them to be aware that, okay, this package I'm going for, when it's time for a particular thing, I can't get myself involved, I need to go get money. So which do you advise for?
This is where the health insurance, whether national or state, is wonderful. Now, she talked about benefit package, partial coverage, and total. You don't choose.
Okay.
You don't choose. Unlike private health insurance, where you go for gold and they will tell you this is what it covers. You go for platinum, this is. But for the
state and
national. The national health insurance, once you have registered, the benefit package, like
it covers everything.
I have a book here, which is called the operational guideline. In this operational guideline, you will see it. This book guides the operation of health insurance in Nigeria. So the benefit package is just a package, only that you come into the pool through different routes. If you come in as a civil servant through the formal sector, you enjoy the same benefit package. If you come in as OPS, it's because you are not in the civil service, you are coming through OPS, the same benefit package. If you come in through the gift ship, the same package. To the point, whoa, why should this escape us? Do you know that we have health insurance for students? So nobody is left behind. The tertiary institution social health insurance program. Remember I said once the enrollee, the spouse, and 4 children below the age of 18. Once a child is above 18, automatically you are taken off the platform. But you can still be a part of health insurance. Either you are in school, the school takes care of you, or your parents can decide to add you as an extra dependent with extra fee. Then, do you know, we also have for the core members. Because health insurance is leaving no one behind. We don't want to hear because I'm a core member, I cannot access care. The good thing about the core members own is that it is fully paid for by federal government and NYSC.
Okay. Okay, now let's not deviate from the question I asked, because I know you go outside and you hear a lot of persons saying these things, that, okay, this surgery I'm about to go for is not being covered by the health insurance. Now, I'm still asking that question. Which package, like you said, once you're registered under the health insurance scheme, it's totally covered. So why do we still have these issues of, okay, I'm going for a particular surgery and my health insurance is not covering the surgery, the treatments?
Then that should be maybe a private health insurance,
possible.
depending on the plan they bought. Like I said, we have one basic minimum package of health services.
Okay.
Under the national and the federal, we have the benefit package. So when you buy, you are buying into that general package.
Okay.
If the package says, she has just told you the exclusions, the partial exclusions and the total exclusions.
Yeah.
Is total for everybody that is in national health insurance ecosystem.
Okay.
Whether through T-ship or whatever, exclusion is exclusion.
All right.
Except for people like core members. Because of their kind of their government property in quotes. So we do not apply these exclusions to them. Because whatever that is excluded in the benefit package, the NYSC is making payment for it. Okay. So theirs is
all right. Okay. Quickly now, your words for those persons listening out there. What advice you have for individuals, parents, and groups? So what are your advice to everyone today?
Viewers at home, I would want to implore us to key into the health insurance ecosystem. It would really help in lessening financial burdens for individuals and families.
Okay. All right. So, Ambassador Theodore.
First of all, I want to appreciate independent television once again, and your humble self. Flipside is one of the programs I enjoy watching. Let people know and come and register. Once you register, like she has said, this fear of, I don't have money, many people are dying today because they don't have money to go to the hospital. What will they tell the doctor? But once you are registered, you don't have that fear. Anytime you walk to the hospital knowing that your insurance has covered you.
Okay. All right, thank you so much for being part of us today and educating us on health insurance. Yes, go get yourself registered today. We'll be seeing again next week for another exciting time on Flipside. Do have yourself